Good morning, welcome back everyone. Close to 3 million Americans are living with atrial fibrillation, also called AFib. Many people believe AFib isn't a big deal, but about 15 to 20% of people who have strokes have this heart arrhythmia. Joining us this morning to talk about the symptoms of AFib and treatment options is Gundersen Health System cardiologist Dr. Ward Brown. Good morning, Dr. Brown. Thanks for getting up with us.
Good morning, Amy.
First of all, can you describe exactly what AFib is?
Atrial fibrillation is the most common chronic rhythm disturbance in humans, and it is a chaotic, irregular beat from the upper chambers of the heart.
So it's an arrhythmia.
Yes, ma'am.
And how does it feel to people that have it? What are the symptoms of AFib?
Well, atrial fibrillation is one of these many times silent problems that people can have. Generally, people will experience symptoms when the heart either goes really very fast or very slow. And in between those two extremes, many times a person will have no symptoms whatsoever. The symptoms that a person may experience are things such as shortness of breath, decreased exercise tolerance. Sometimes a person may feel some irregularity in their heartbeat. Occasionally they'll get chest pain.
Okay, so it sounds serious, yet a lot of people don't think it's a big deal.
Well, back in the old days, back when I had hair, the doctors themselves think it was too significant. But we realize now that it is a rhythm disturbance that does have some potential major consequences, as you already mentioned, stroke being one of the major ones.
So if most often you don't recognize the symptoms, how do you know if you have this and if you're at risk for a stroke?
Well, one of the things that a person can do is if you check your pulse and you feel that there's some irregularity present, that may be an indicator that you have atrial fibrillation. Many times we find that people will have the rhythm disturbance discovered during a routine physical examination or when they're seeing their healthcare provider for some unrelated concern or issue.
And then once it's determined that you have AFib, what can you do about it?
Well, at that point, then it's a matter of determining what your risk is for the development of stroke. If you're someone who's had a history of heart failure or diabetes, hypertension, or previous stroke, those are all things that can potentially increase your risk, as can increasing age.
So it sounds like, of course, if you have symptoms, go in and seek treatment, but also don't forget about those routine, regular checkups.
Correct.
Mm-hmm. All right, Dr. Brown, thanks so much for joining us again. February is Heart Month, so you shouldn't ignore it any other month of the year, but especially this month, take a little extra time to make sure you are in good health. Thanks, have a good day.
Thank you.